If I have a mild brain injury, then why are my symptoms so severe? My name is Hillary. I am a licensed and certified speech-language pathologist, and I specialize in concussion and cognitive rehabilitation. So let's talk about the difference between the medical diagnosis severity and the symptom severity. The concussion, or as we also call it, mild traumatic brain injury, is just what it says. It is a mild brain injury. And there are medical criteria that then would have it be more severe, moderate, severe, and so forth. But in order to hit the moderate category, you actually need to have sustained a loss of consciousness for at least 30 minutes. So if you're unconscious for 29 minutes and 59 seconds, technically speaking, you could still be diagnosed with a mild traumatic brain injury or a concussion. That doesn't, however, indicate how severe the symptoms are, and it can be wildly different. You can have patients who have a severe brain injury, and they can leave the hospital walking and talking as if nothing happened. And then you have patients who have concussions who are coming to my office and going, my life is terrible. I can't function at work. I can't function at home. Why are these symptoms so severe if I just have a mild brain injury? And it has to do with the metabolic cascade that happens after your injury, where you're not necessarily aware of immediately what all your symptoms are going to be. And then you have kind of this like growing effect where if you don't sleep for one night, no big deal. But if you don't sleep well for nights upon nights upon nights and week after week after week, it's going to grow. You're going to have this sleep deficit. And if you think about that for all of your symptoms, I had attention issues, so I started making mistakes at work, and then those mistakes started piling up. Or I have headaches, and I constantly have headaches. Or I've got neck pain, and I'm constantly tight. It's going to affect you for longer than you would expect. So don't discount the fact that you had a mild concussion means you can only have mild symptoms, because they're completely unrelated as far as the diagnostic criteria of how we determine what is the actual brain injury and what are the symptoms themselves. If you are struggling, please make sure that you're reaching out. Find a practitioner who specializes in concussion who can help get you back on track sooner rather than later.